Dr. Kylie, let's start with you, please. So, um, you have lots of experience uh, in the medical profession, but also working with corporate, businesses in Africa. Um, what, how would you describe the current state of healthcare and well-being for employees in Africa right now?
I think there are a lot of people struggling. I mean, we had quite good wellness setups before COVID, but then after, with the advent of COVID, a lot of companies were doing, twice a year, they were doing screenings for their employees for the chronics, blood pressure, glucose, cholesterol, HIV. With people not being in the offices, that fell apart. So we're seeing a huge surge in unmanaged blood pressure, cholesterol. The cancer is only being caught now at stage 2 and 3 as opposed to being caught early. We've seen a lot of people neglecting their normal medical checkups because of fear of going into the doctor's rooms. But one of the most worrying aspects we are noticing is the huge increase in mental health problems.
In the introduction, I mentioned that you work with some companies as a sort of in-house counsellor. So what sort of conversations are you having with people there? What are the sort of main topics that you're able to guide them through that situation?
A lot of the things we are picking up is feelings of hopelessness, being overwhelmed. They just loss of motivation, loss of energy. We're seeing a lot of post-COVID mental health issues. I'm sure the doctors also noticed that, where people post-COVID have got post-traumatic stress syndrome. So I'm getting a lot of calls for help with that. They just can't get themselves going anymore. They have lost their, zest for life. I'm sure you also know in South Africa we've been struggling a lot with floods in KwaZulu-Natal. So we've actually been getting a lot of requests with that, where not only are we dealing with COVID, we're getting people losing their homes, their livelihoods, people are losing their lives, and there's trauma with that and a lot of anger coming across from that as well. People are just, and there seems to be a fear of being with people again. So now that we are going back into the workplace, people were fearful of working from home. Now people are fearful of going back to work. So we're getting a lot of return to work issues coming up.